My role is primarily to offer the surgical service and discuss the surgical options, but it's also to act as a counsellor, someone to guide them through their treatment process, to explain what they can expect, and to coordinate all of their care. It's a very distressing, very traumatic time for patients to receive this type of diagnosis, and being the first medical practitioner generally that you encounter, the first specialist medical practitioner you encounter with regard to the diagnosis means that I'm usually the one bombarded with the hundreds of questions about what this means for them and where it might take them. So I'm kind of part surgeon, part psychologist, part breast care nurse. It's a whole bunch of things rolled into one, really. The benefit of working in that type of situation is you have input from all your other colleagues, your oncology, your radiology, your pathology colleagues, and no surgeon really should be an island. We have lots of information, we're very knowledgeable in many respects, but we don't have all of the information at our fingertips all of the time. And I respect all the input that I get from my colleagues in terms of decision making so that we can come to the best treatment for that patient. And because patients are so different, they all require something slightly different. Well, making the decision to become a surgeon was really easy for me. I really like the fact that it's hands-on, it's almost instantaneous type results for your patient. And so I enjoyed that very much. Making the decision to become a breast surgeon was a little bit more difficult, but I discovered that I really quite enjoy talking to my patients. And I gain a lot from the long-term relationship that I have with my patients. You know, I find out things about their families and their grandchildren, where they've been on holidays, what car they bought and whether it's good or not. And sometimes it's basic as, you know, finding the name of a good hairdresser around the corner from me. And so I find that I benefit greatly from these types of relationships. And I go home every day just feeling a little bit more grateful for my health and all of the people that I love who surround me. There is a lady who I met, I think, late last year, and she was roughly my age and had young children, which really resonated with me. But hers was a cancer that was really very aggressive, and she'd come as a second opinion from another part of Australia. And it wasn't something that was operable. I really, really wanted to do something for her. I just felt the idea of doing nothing for her. I couldn't deal with it initially. And I struggled with that a bit. But then after multidisciplinary discussion and lots of discussion with radiology colleagues and plastic surgery colleagues, we agreed that actually doing more surgery would be doing her a disfavor rather than a favor. And that it was probably better for her not to have any further surgery. It was a very helpless thing for me to undergo, this idea that I couldn't give a patient any more quality of life, but I would actually have done her a disservice. So that was a lesson that was difficult to learn, but I'm glad that I did learn it in the end. And the hardest part about my job is breaking bad news to people. And for different people that means different things. It might mean saying that you need a mastectomy rather than a lumpectomy, or that the cancer is very aggressive and you need chemotherapy as well. And these are all things that are very traumatic for a patient to hear. There's no really easy way to overcome telling this type of bad news. I think the best thing to do is to recognize where a patient's at in terms of their psychology and find the best way to break it to them. I have to admit that my heart is always in my mouth every time I read a pathology report. Like, it's just pounding, waiting for a good result for a patient. I'm always thinking, please, please let it be good for them. So when it's not, it is very disappointing both for me and the patient. But what I have to do is I've got to see all the good sides of it so that I can give the patient hope. I think that's a really important thing, is to find something good out of that situation so that you don't make the patient feel like the situation is completely hopeless. For myself, the thing that I have to do in order to keep going through these types of consultations is to debrief on a regular basis to a colleague who understands what I'm going through. I think that's very important for all oncology practitioners. Oh, the most rewarding part of my job Well, there's two aspects to it. The first is when I've done a really good operation. I feel really good when I've done that because you can see it, it's tangible, the patient can see it and appreciate it, and I really do enjoy that. But the second thing is, as I said before, that long-term relationship that you develop with the patient, getting to know them, and it makes the consultation days quite enjoyable once you've got to know somebody really well. And when it comes time to say goodbye to them, you can get a little bit sad.